Hey, what's up guys? It's Jen. Welcome to Momming with Migraine, to my office, and actually welcome home to me because we've been gone for the last couple of weeks for my blood patch. I am 2 weeks post-op. We have flown home, we're settling in, and I'm ready to tell you guys what the blood patch procedure was actually like. Let's do it. Watched that intro back and got a zit that's in here looking like something other than a zit. It's a zit, I promise. Okay, so my blood patch procedure. A little weird, scary, intimidating. I had a little bit of trouble finding stories from patients online, especially over video, so I thought you guys definitely need to hear my version of the story, my version of how blood patch went. This was my very first blood patch. So even though I knew what to expect, I didn't quite know exactly how it would feel, and this being my first time definitely increased my anxiety. If you are going into your very first blood patch and you're watching this because you're nervous about it, don't be nervous about the procedure. It ended up being way easier than I anticipated it would be, and I attribute that, of course, to the skilled hands of my doctor. Just make sure that you are with someone who you trust wholly, and that will help you a lot with the anxiety that you're feeling. But let's get into the details of the procedure because I know that sometimes knowledge is power and it can really ease your mind if you know what to expect going into it. In case you're new here, I will really quickly fill you in on the blood patch and why I got it. Momming with Migraine is my channel name. That's because I have chronic migraines. But it appears the chronic migraine disease is sort of being triggered by this brain fluid leak, and this epidural blood patch was to try to help my brain fluid leak. My brain fluid is leaking from somewhere either around my brain or down my spine, but we don't know exactly where yet, so this blood patch was a non-targeted blood patch. In layman's terms, what they basically did was fill my whole back with blood, like as much blood as they could, while I was awake. The epidural blood patch is an outpatient surgery, so even though it is a very serious procedure, you do get to release the same day. A few days before I went in for my blood patch, I got a call from the clinic and they gave me my pre-op instructions. They told me things like, don't eat past midnight the night before. They said that clear liquids were okay until 6 a.m., things like tea or coffee. But then after 6 a.m., I had to cut it all off. That was super fun with 2 toddlers. I made them a beautiful eggy omelet breakfast and I couldn't eat any of it myself. That's okay though. I'm also breastfeeding, so we also had one last breastfeeding session in the morning before I went in to get put on a bunch of drugs and initiate the pump and dump cycle. I'm not on any medications on a standing basis, so I didn't have anything to take the morning of, but if you do have prescriptions that you usually take, you can talk to your doctor and see if you should still take those in the morning. As far as what to wear to the hospital, what you're really concerned with is getting dressed and undressed when you're super loopy and where your scars are actually going to be. So they say loose, comfortable clothing, easy to get on and off, but what I actually did was I wore a full-length maxi skirt with a loose-fitting t-shirt. And the benefit behind the maxi skirt is that I could wear it anywhere along my body and still have it make sense, and that way I could move it to different areas on my spine based on what was sore at the moment. I actually kind of lived in my maxi skirt for about a whole week post-op because I kept needing to move it up and down just to avoid the areas of soreness. So 10 out of 10, I recommend wearing a skirt, unless you're a dude and you want to get looked at. The first check-in table is about who to call and your preferences for when and how to reach your family when you're getting out of your procedure. Every hospital is going to be different, but they had options like, do you want us to call and let them know the second you're done? How much time do they need for warning to be able to drive you home because you can't drive yourself home? So like, how much warning does your family need to come pick you up? Stuff like that. All of those things are done before you even get taken back. You guys, the staff was so friendly too. I think everybody who's there knows that you're gonna be kind of nervous, and so they're like really encouraging and really friendly and just wishing you well the whole time. So I hope that you guys have as good of an experience with that kind of stuff as I did. Of course, one of the first things they do when you get taken back is the standard. They take your blood pressure, they take your heart rate, they take your height and weight, and then they show you to a little room that's sort of private. It's private by a curtain, but I mean, you're sort of in a room with a lot of people. Let's be real. And this is the point where it really starts to feel like a surgery and not like your standard checkup appointment. Of course, they have you changed into the robe. My procedure was gonna be on my back, so it was an open in the back situation. They also had to check on things like, am I pregnant? I'm not, I'm on my period. Of course, I was on my period for my blood patch. And they also did things like confirm why I was there and confirm my preferences for options that could arise during the procedure while I'm on too many medications to answer the questions for them. For example, because I know that was really confusing, if for some reason they were not able to draw blood from me during the procedure, do I want them to proceed with the fibrin glue? Or do I want them to just remove everything and we'll come back a different day and hope that they're able to draw blood that day? Would I like to accept or reject the option to move forward to fibrin glue, for example? All of those things had to be decided before any drugs. Now we're getting to the pokey pokey lemon squokey. First poke was the IV line. They pretty quickly started me on saline. You don't get to eat or drink in the morning, so you get there and you're pretty hungry, you're thirsty. I don't remember what else I was feeling, very sleepy. They did my IV for medication in my left hand. They kind of looked around, we talked about it. I felt like I had a say, but I also felt like he really wanted it in my left hand, so I was like, that's fine, do my left hand. Part of why we chose my left hand over something else was because of the position that I was gonna be in the OR. That was gonna be easier for them. But also they needed access to my right vein over here. Since this right elbow is stronger than left elbow, they wanted to keep this one for medication and this one for the clean blood draw, because that clean blood is gonna be what's gonna go into my back. So that's what this is for. Spoiler alert, that's not where the blood ended up coming from, but that was the plan at this point. So at this point, the saline is dripping and we're basically just going over questions. Hey Jen, do you have any metal implanted in your body? And at a point, my doctor also came out and he talked to me about exactly what we were doing and just made sure that we were on the same page. Gotta say, talking to the doctor pre-op is some of the most calming time that you're probably going to have beforehand, because you'll see how calm and ordinary this is to them. They're like, yeah, I'm just at work. I do this day in and day out. This is my 9 to 5. Like, it's this crazy event for me, but it's not a crazy event to them. So I really enjoy that time with my surgeon. I feel like I'm not unique in this. The saline makes me freeze half to death. So I was like, can I get another warm blanket? Can I get another warm blanket? And I just kept getting warm blankets on my body. It was very nice. So after all of that, they made my husband leave and it was about time to roll me back. At this point I have my IV line, I'm hooked up to my drip, I had my robe on, I had my hairnet, and I was on one of those beds that just rolled you away. So they took me to roll. I was like, hold on, can I change my pad real quick? Because I didn't want to be dealing with my period immediately post-patch. So they let me do a quick stop like at the very last second to do that. And then they put me back on the roll away thing and they rolled me away into the operating room. Now at this point, not gonna lie, I'm like, where are the drugs? Where are my drugs? I'm nervous, guys. Where are my drugs? And like, I have a totally dead straight face. Like, I'm so calm on the outside, but on the inside, I'm like, can we just get this done? I'm just like, I want to stop signing papers. I want to stop talking about questions. I want to get to the part where the needles are coming out of my back, not going into them. Why haven't we done any medications? But obviously, you guys, you have to wait until you're in the room with your doctor for them to start administering the medication. And it's all super fast acting. It's going to be acting by the time you need it. Don't worry. I think I was just thinking it was going to take time to settle in or something. Like, don't worry. They know what they're doing. So they wheel me into the room and they actually kept me on the bed that I was in for a while. And then there was a second bed in the OR waiting for me. And they wheeled me in the first bed and they left me in the first bed for a while, actually. Here's what we did in the first bed. This guy and my arterial line. So I was laying in the bed and they had to sterilize this entire arm, shoulder to fingertip, because once again, they're pulling this blood out and you don't want to take this blood out and put it in the back and have there be an issue, have there be any kind of contamination. So they actually did a whole full-on surgical prep for this arm to place the line. My arm had to be straight up. They did the wipey, the wipe everything, laid it down, did surgical draping over it, stuck a line in here. You can still see my little dot. But unfortunately, after a few minutes of that, it just wasn't quite pulling blood. It was pulling a little bit. I have a really good vein, but it was a really fat needle, and we were thinking it must have hit a valve or something because it just wasn't pulling a lot. And we needed to be able to pull a lot of blood in like half an hour. This is not to be used right now. They needed to place this line and then flip me over and then place all the needles in my back. And then they would be able to draw the blood. So it just wasn't worth the risk of waiting. We decided to go ahead and put in the arterial line instead. Pulled this one out, bandaged it up, onto the A line. I've never had an A line before. This was my first time. Do you know anything about it? Ooh. A line is arterial. It went in right here. They did a little numbing shot first, and then he had to use this little itty bitty little teeny tiny little ultrasound doodad, and he's like doing a little ultrasound and guiding the needle in, and I was watching the ultrasound screen while he was doing this, and I saw nothing. I don't know what he was looking at, but then the line was in, and it was fine. So it was fine. If you need an A line, don't worry about it. It's fine. All right, once that line was placed, I was like, holy cow, so excited because we were finally going. And I knew that within like an hour, it was all gonna be over. My arm, everything was all prepped on this arm. So what they had me do was roll from the bed I was on to the new bed like that, not allowing my arm to touch the bed. And that way I would be on my tummy on the new bed. It's like the first bed that they wheeled me in on was just for the surgery of the blood prep. And then they moved me to the new bed for the surgery of the back stuff. Right as I was finally not freezing cold anymore, they made this all wet and sanitary, flipped me over, got my entire back wet and sanitary, and I was freezing again. And I was shivering on the table, and I was like, no. No, last thing you want is tremors when someone's about to your back with a needle, but obviously they're gonna wait until the tremoring stops before they place any needles. I don't know the extent of all of the medications that were put in me, but I know that there was stuff to make me calmer. They did push Benadryl, which I know because it burns like heck when it goes into your arm, but that helps with avoiding any allergic reactions, inflammation stuff, and it also made me fall asleep. I got totally sleepy, I assume from the Benadryl, and when I flipped over on my belly, I was pretty much dozing in and out for the rest of the procedure. When they get you on your tummy, you're sort of on a massage bed. I had a pillow under my entire torso. It went from like here to here, that I was laying on my tummy to kind of round my back. I'm only 2 weeks post-op, so I can't do it to show you, but it kind of elongates your spine, I guess opens it up a little bit for the surgeon. My head was in the massage pillow thing, and then there was a table in front of my head, kind of like above my head, where they draped both of my arms. And that allowed them access to my blood line, which was on this wrist, and my IV line to push medications, which was on this wrist. At some point, they put me on some fentanyl, and then I also know that they strapped me down, at least on my legs, but I don't know what else was strapped down. And I know about the strap on my legs because I jumped. I jumped when he stuck a needle in my back. So aforementioned falling asleep. I'm nice and relaxed. I want to be nice and relaxed. But pretty much what happened was, one moment they were doing all the prep stuff and something else, and then the next moment I was being woken up, jolt, to a needle going into my low back, and I was like, and then I heard, "Don't jump, Jen," and then I heard, "Can we get another 25 milligrams of fentanyl, please?" So that's how the first needle placement went. After that, I was a bit more awake, obviously. I was paying a little bit closer attention because I was like, whoa, don't jump, Jen. So I actually was there and sort of cognizant for the next needle going in, and it was weird. We had some x-ray guidance going on, some fluoroscopy or something. I don't know if this was the thoracic one or if this was the upper lower back one, the L4-5 area, but he would like push in a little bit, and then he'd say like picture, or like take a picture, or like image, or whatever he said. And they were doing x-rays. I didn't see the x-rays until after I flipped over, but that's what they were doing. I think he was like putting the needle in a little bit, seeing exactly where it was, needle a little bit more, see exactly where it was. And yeah, they were just like doing fluoroscopy guidance this whole time. And honestly, guys, very comfortable. If I was not comfortable, then I don't remember very much of it. I obviously did feel discomfort as the needles were going in. I had a jump, which, you know what? I was like freaked out at the beginning. I was like, wow, I could have messed that up a lot. But now that I'm thinking about it, they probably expect that some people jump every once in a while. You know, they probably are like kind of ready for it sometimes. How many people fall asleep during twilight sedation? Maybe a lot. I'm always scared that I have a lot more say in this and I could mess it up a lot more than I actually can. Skilled hands, they've got this. Then the best thing happened. He said, okay, Jen, all the needles are placed. Yeah. And in my head, I was like, don't roll over. Not that I was gonna, but like, you know, your mind on drugs, you just start thinking about like, okay, we got it in, this is good. That was so exciting because I was so nervous about the needles. And then he said that I might feel warmness or gushiness as the blood goes in, but I didn't really feel any of the blood go in. The next thing I remember feeling was a little bit of pressure in my head, and there was a little bit of a warm wave that went down kind of this way and down my legs. And so I let my doctor know, oh, I feel something in my head, my feet feel warm, and I don't know exactly what he said, but then he was like, we're done. Like, what? We're done? Yeah, we're done. So then Jen on drugs, I'm like, wait, but did he put enough blood in? Did we do enough? Did we do enough? Like, did I wait long enough to tell you to stop? Like, what happened? But like, it all happened so fast and I was so out of it that who knows? So then apparently doctor went to my husband to let him know that everything went well, and then I met him in the post-op area, and that was where he filled me in on how much he got in. He got 10 milliliters up in my thoracic. He got 15 cc's down in my lumbar in the first one and 15 in the other. So we got a 40 milliliter blood patch. It was a high volume blood patch as far as I understand, and that was, I mean, as much as we could have asked for. So we're really happy with that result. I remember the flipping over process. I kind of got yelled at for being a little bit too eager. So I was on the massage bed one, and they needed to roll me back over onto a rolly one so they could roll me back out of the ER. Immediately after your blood patch, you have to stay flat on your back with no pillow in the recovery area for 2 hours. So they wanted me to just roll over onto this other bed, but I lifted up my head, looked over, saw the bed, and started like army crawling to it. I was like, oh, you need me over there? I got this. And I started going to it, and they're like, whoa, you just need to roll, Jen. You don't need to do all of this. Not, oh, okay. Roll over. Yeah, you never know what's gonna happen when I'm in there, because I just do whatever I think I'm supposed to, and I can get a little bit overzealous when I try to do things with my body. I'm just very like, go. I'm a go-getter to my own detriment. Post-op was really cool. They said to expect pain, expect nausea, but I was still on all of the things that they gave me. So laying there, I was really comfortable and really happy. I was mostly relieved that the patch was over, and I was just happy to be there. I didn't start to feel soreness until many hours later, and honestly, it wasn't that sore. We'll go into the recovery another time, but for now, I feel like that's just about everything that you need to know about the blood patch procedure itself. If you have any specific questions about my patch or how it went or how it felt, please feel free to drop them in the comments and I'll do what I can to get to them. And I'll see you guys in the next video.